Okay, hello everyone. Dr. Rich Castellano here. Let me just make a few little adjustments. There we go. There we go. Perfect. Okay. And all right. Hello everyone. Dr. Rich Castellano here, the Smile Doctor. We are here today with Bones. Bones, thank you so much for allowing us to do some teaching and recording for your procedure today. And here is the before, where you can see those upper eyes. He wanted to trim a little bit of that eyelid skin there. So I'm just showing these. We are on the YouTube and Facebook, so we're trimming some of that excess eyelid skin. We'll take just enough, but not too much. And so we've got the camera angle here so that doctors and students that are watching can learn to see how we like to do our one-stitch procedure. Bones, do you feel that relaxing medicine settling in?
Yes.
Very good. So do you mind sharing, what was it that inspired you to just trim a little bit of that eyelid skin? What was it that you were looking to achieve?
So my right eye, I can have a little better vision.
Yep, because it can start to block the vision. We've got a great technique where we do the one stitch. Traditional eyelid procedures take skin, muscle, and fat for everyone. We primarily take the skin and sometimes a little bit of muscle, but you want to leave as much of the muscle and fat as possible because you don't want to overdo it. And so you'll see at the end we do one stitch that goes all the way across to close things up. So what I'm going to do now is I'm going to use my little marker here. And of course my team has set everything up perfectly. Makes it very easy for me. Thank you, Ariola.
Thank
You can find us at imagelift.com, and that's where we have before and after pictures, and you can learn more about what we do. We're in our Villages location today. And we like to give, so now I use the little ruler to just measure, as they say, measure twice, cut once. And so I go into the medial canthus when I'm drawing that out, and I'll use about 15 millimeters from the last eyelash. It's very artistic when you draw out your lines for the procedure, but you just follow the normal creases of the skin to guide you. And when you look at the face very closely, you will see that everybody has some asymmetry. Smooth forceps, please.
Yes.
Everybody has some asymmetry. So when you're designing the incision, you take that into consideration. I'm going to start to do some of the numbing medicine here in just a moment. And patients enjoy our technique because it's all done under local anesthesia. No general anesthesia, no IV sedation, and you don't need to remove the muscle or fatty pocket in a large number of patients. So that's why you really want to do the least amount of a procedure possible to achieve the result. So for the students and physicians that are watching, thank you all for your comments. We'll be using 1% lidocaine with 1 to 100,000 epinephrine. And right about here. I normally do a follow-up at 1 week for sure, and sometimes I'll do a 1-day follow-up. It's just optional per the patient. And once I do the numbing, then they can't feel anything. Now you'll notice when I pinch the skin, if I pinch too much, then you see his eyes start to open. So I just take just enough that it gets the effect without making it difficult to close the eyes. So I've marked out this area, and when we numb, you will see a little bit more swelling. The eyelid skin is some of the thinnest skin in the entire body. This is 1% lidocaine with 1 to 100,000 epinephrine. So you'll feel a little pinch here, bones on 3, 1, 2, 3, pinch. You feel a big pinch, little pinch, not too bad?
Not too bad.
Everything's looking good. So you can look us up at imagelift.com for the doctors and students watching. If you'd like to learn how we take care of our patients and the systems that we set up, check out our website. It's practiceprofitabilitymd.com, where we help doctors learn how to run their business effectively. Our 2-day live event is coming up in Tampa in April 20, April 21. Mark your calendar. Very proud of our doctors that have gone through our training. You feel a little bit of a pinch there, Bones?
Yes.
Small, medium, big? Not too bad?
Not too bad.
Another pinch here on the side. 1, 2, 3, pinch. Everything's looking good. Our primary goal, of course, we want to make sure that Patients feel comfortable. We've done the Hibiclens, prep, sterile drapes, pinch on 3, 1, 2, 3, pinch, and of course a sterile gown and glove. So it's a very straightforward procedure, and recovery, there's really not so much physical downtime. Physically, you can get back into your routine the same day or the next day. You'll have a little swelling around the eyes. Socially, you pass the grocery store test, probably 4 to 7 days. The eyelid stitches come out at about a week. If you're wearing sunglasses, right away you can cover and be out and about. But if you don't want anyone to know, you need to give them about 4 to 7 days. Sometimes it can take a little longer with swelling around the eyes, and you want to be careful to things that can make your eyes swell a little more. Smoking, chemical exposures, perfume, things of that nature. People talk about getting sun after procedures like this. Sun or before or after cosmetic treatments damages the skin. So that is always a good idea to protect and avoid the sun. So now we've done the thank you for watching. Oh, thank you, Dave. Appreciate that. And so I'm going to hold a little bit of pressure. Everything's looking good. Perfect. So now that I've let that numbing settle in, so Dave, you're going to feel pressure. If you feel any pinching at all, you let me know. And let's see the little pedal down here. That's perfect. So, Dave, do you feel any pinch or anything like that?
No.
Bones, there you go. I was looking at the camera saying, hey, Dave, Bones. And we're here with Ari, we're here with Bones, and this is Dr. Rich talking. Very good. All right. Now, sometimes when I do the incision, sometimes a little bit of the numbing medicine can seep out, and you might feel a little tiny bit of burning in the eye, which goes away very quickly. So nothing that hurts the eye, that's just the lidocaine, the numbing medicine. Everything's looking good. It's always better to come back another day and do more rather than go too far. That being said, I always go for the gold. We go for the best result possible. And then I'm just teasing away the excess skin through here. Very good. Bones, how are you feeling?
Good.
So as you can see, there's really very little significant bleeding. We'll do a little cautery. You could theoretically do the procedure with no cautery at all for hemostasis. Hemostasis is the fancy word we use which basically means to control the bleeding. So we've trimmed away some of that skin there. And then I use my bipolar cautery, use an electrical current. Hello, Mike. Hello, Cherie. Thanks for joining. Looking forward to see some of your guys' videos. Okay, so just a little cautery. Super simple. Patients really appreciate this type of procedure. Some doctors will say, no, you got to take muscle and fat from everyone. But you really want to focus on doing the least amount of procedure to get the best result. And less surgery is better. People are living so much longer now, and you can skeletonize or hollow people out. So we're very proud of our technique, we're proud of our results, and we're proud of our patients. And I'm going to trim just a tiny bit more skin. Can I have the iris? That's perfect. I want to take just a little bit right in this area here. As the artist, you can fuss over the little details, and that's what makes it an artistic result. Everything's looking good. We give patients pain pills after procedure like this, but some may take only Tylenol, some take all their pain medicine, but everybody's different with their pain sensitivity. Usually when you're taking the pain medicine, though, it's not something that is significant. So now, thank you for watching. Thank you for tuning in. So this is a 5-0 Prolene, okay? And this is a running subcuticular suture. So you're basically just running intradermal, and and keep it that simple. The eyelid skin is very forgiving, and when the incision heals, it's very difficult to see. Our 4 categories of improvement in the face: if it sags, we tighten, so we're doing some tightening here of the eyelid skin. If we lose volume, we fill. And the surgical goal for that is don't take away extra volume that you don't need to take away. That's why we do this type of procedure, to preserve the muscle, preserve the fat. If we get sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. And then the 4th category outshines everything else, and that's our behavior. And none of our treatments look as good as Mother Nature's free facelift when we smile. Bones knows the power of smile. He's a good smiler. Bones, how are you feeling? Are you feeling any discomfort at all?
That feels good.
Okay. We're feeling pretty good too. We didn't take any relaxing medicine though. We're just feeling good naturally. You know, I had a good breakfast. I got a great team. I am so proud of our team. Hello, thanks for tuning in. Hi, Lynn. I really am so proud of our team. I mean, I love coming to work, and we've got a wonderful group here. They take such great care of me. I feel very loved and well taken care of, and they take great care of you as well. If you have a family member or friend that would love to meet our team, let us know. Give us their name. We'll reach out to them. You can give them a free gift just from watching this video. Tell them you can give them a gift. They can call our office, Dana, our esthetician. We'll do a free facial mask treatment. See how nicely that comes together? 1 stitch all the way across, right? Super simple. When I was in my training, we used to put so many different little stitch here, little stitch there. Just 1 all the way across is enough. And patients appreciate that, because when it's time to take the stitch out, all I do is I just trim that 1 little knot, okay? And then it slides right out. Perfect. Bones, how you doing?
Excellent.
Leave the tray right there. Can you scoot the tray back just a little tiny bit? That's perfect right there. I'm gonna give this to you. Everything's looking good. Okay, so now, that's perfect.
Okay.
And we're doing both sides today. Now we're going over, watch the tripod, that's perfect. So I'm gonna do just a touch more of the numbing medicine. Watch your finger. Perfect. It's all about good communication between your team. So we have our system down. My team, they know exactly what we need, and it makes things flow so much smoother, so much easier. There are a lot of doctors that they do these things under IV sedation or general anesthesia. I don't really feel that that's necessary. You can see how comfortable Bones is. Bones, can you open up your eyes for me, please? So his eyes will feel difficult to open because of the swelling, but they will open normally. And how many fingers over here?
2.
How about over here? Can you see?
3.
Perfect. So he can see. Now go ahead and close your eyes for me. That's perfect. So now I'm going to use the 15, and that helps us to make the little incision. And I'm going to turn your head just a little bit this way. That's perfect. Good. Okay, good. You'll feel pressure if you feel any pinching or anything like that. You let me know. Everything's looking good. Perfect. So that's one side. This is called a fusiform skin incision. Fusiform is the shape of the skin that we are removing. And we're not in a hurry. Always fast, but never hurry. And once I make the little skin incision, then we just trim that area out. And it really is that simple. Now the key is, where do you draw the incision lines and how do you make them? And then it's the technique of being delicate to the surrounding tissues, helps with reducing bruising, helps with improving your healing time. But there are some people that just heal differently, and some are more quick and some take a little longer. And that's the beauty of being in medicine, is that there are always differences that you will find in your patients. So now that we've trimmed that little bit of skin there, so we're getting ready to wrap things up here. My bipolar cautery, you see that electrical current turns into heat energy that cauterizes the blood vessel. See the little blood vessel there, and then just a little tap, tap, just almost like I'm painting. Like Bob Ross. Was that his name, Bob Ross? Just a little brushing there, little brush strokes. It is very artistic to do surgery. It's really enjoyable. You have to be very present in the moment to do surgery well, and that's what we enjoy. Perfect. And we enjoy that you are watching. Hello, Pragna. Thank you for watching. Please do share. We are on Facebook, Periscope, YouTube, you name it, we're there. So a little bit of the cautery, and some would argue that you could even bypass that. Now I'm doing a 5-O-Proline. Hello, Lisa. Thanks for tuning in. We're happy to help you out. People talk about what the costs are for these things. You can go to imagezift.com/pricing, and you'll see we posted some of the pricing there. And if you have questions, or you want me to send you if you want us to send us some of your pictures and do an evaluation, we do have patients from all across the country, even internationally, that come in because they want our technique. We're proud to be the #1 Bellafill injector in the United States. And we do approximately 200 syringes of filler every month. I'm the injector. We don't have a nurse that does those things. It's just me, because the difference with the doctor's perspective, we feel we have something better to offer, of course. And we will be in Las Vegas soon at the AMAA4U meeting. AMAA4U.org. And then we're going to be in New Orleans in March. Vegas again back in July. And then Phoenix in August. So busy schedule ahead. Bones, how you doing?
Good.
Everything's looking good. You're gonna love it. Now, of course, Bones, we can't be held responsible for any behavior you get involved in when you look younger now. You're gonna have to be, we'll release you on your own recognizance. We know you'll behave.
That'll be good.
He'll be good. All right. So as long as the patient's comfortable, some patients, they talk through the whole procedure, some just relax. As long as they're comfortable, they can still smile, we're good. And if a patient is not comfortable, we'll give them more relaxing medicine, we'll do more numbing medicine, we'll do whatever it takes to make them comfortable. And my niece was 3 years old when she came through, and she had a gash right in the middle of her forehead. We numbed her up and stitched her up. She did not shed one tear. And so we will make you comfortable. We are in Tampa and the Villages, Florida. Thank you for watching. If you're just now tuning in, I'm Dr. Rich Castellano, the Smile Doctor, double board certified facial plastic and reconstructive surgeon. We are wrapping things up here. Everything has gone perfectly. We're very proud of Bones. I like to do my little knot here that keeps it in place. And Adiola, you're gonna come from this angle, right in through here. Or I'll help you, thanks. Perfect. So then we just trim this little stitch here. And then last little bit. So thank you for watching. We'll have more videos coming soon. I'm Dr. Rich Castellano. For the students and physicians watching, look us up at Practice Profitability MD if you want tips on how to help your practice thrive and become more profitable, how to take great care of your patients. I'm going to show you a before and after picture one more time. Bones, how you feeling?
Sure.
Open up your eyes for me. How many fingers here?
2.
How about over here?
3.
Very good. So we'll show you from, now he's swollen now. So as we say, you don't want to taste the chocolate cake before it's done baking. But you can see where his eyes were, and his focus was the upper eyes. You see where his eyes are now. And this was the upper eyelid skin. He had that hooding, so we just trimmed a little bit of that extra hooding up on the top. We'll show this down in through here. Okay. So we're very proud of Bones. We'll have more videos coming soon. Thank you all for watching, and we will see you soon. Bye.